But if it's a place that really we must see a change, we must confirm that things have changed, is in Wajir County. Because it is well evident that in the last 15 years, Wajir County had only one doctor. And later they had only 2 doctors. But as we were having discussions yesterday, we confirmed that Wajir County has actually 74 doctors now, with 21 consultants who are all in job group R. We also have about 50 medical officers who are in job group M, and we had discussions with the county who has committed that all these doctors will be promoted. It means that the level of access to care in the last 15 years in the county has improved more than 100%, or more than, I would say, 300%, because the number of access to care has increased. That is what is expected. We are also more elated that level 5 hospitals is now being opened. And what that means is that the more healthcare workers are going to be employed. And that's why we are joining the chair of the Council of Governors, the governor of Wajir County, that this county now needs more money so that we can have the welfare of the doctors, the welfare of the people of Wajir catered for. But the commitment so far that he gave us yesterday regarding the employment of more doctors, regarding the promotions of the doctors, is something that we really welcome, because we believe that the motivated workforce is what will ensure that the people of Wajir get the best care. We want to also say that we looked at the equipments available at the moment. We looked at the plans even to supply the drugs, because you can have the hospitals, you don't have the drugs, you don't have equipments, we may not have any care. So as doctors, we need always to be supported. The government, the county government made a resolve and a resolute that the welfare of the people of Wajir, that will ensure people are getting the best care, is going to be ensured. And one thing that is very key, the doctors, the consultants that are here in Wajir are not consultants who came from somewhere else. They are consultants who were trained, who went to school, were bonded, were trained, and came back to offer the services here. We have agreed with the county government. That plan of training has to continue, and therefore the numbers of doctors that are going to be released to go to school, to be neurosurgeons, to be more obstetric and gynecology, to have different specialties, is going to increase. And that is the value to have a progressive system. We also talked about the terms of doctors that who are on contracts. The governor has actually confirmed that the next financial year, all these doctors will be confirmed to PNP, because then that means that when you see a doctor, when the doctor is managing you in the county, and when you come back to the hospital with their specialty, you will again be seen. That is the collaborations we've had in Wajir, and we believe that if this is the progress what we can see in counties, then the issues of doctor strikes that we have envisioned over the time will be a thing of the past. And we had confirmed to the chair of the Council of Governors that these engagements, these dialogues, then opens the way to make amend to any issues that may be upcoming. And that's why yesterday we had over 5 hours meeting with the governor. We had another 3 hours meeting with the doctors. And this is something that we must praise, and we must say that the commitments of the leadership, the commitments of the doctors is what ensures that there's a healthy county and there's a healthy health service delivery in the country.